life support, right? As I understand, there's some the medical students and paramedics among you all as well. Yes? Okay. Plus. Okay, so we'll just quickly go through a scenario on BLS. I think maybe before we start, you all already know how to do BLS? Show one more time. Okay. So you all want to do a scenario first, and then after that I show you how to correct it. How you all want to proceed?
Never mind, you show us first.
I show it.
Okay, yes.
Okay. Maybe we do it on the floor, lah.
Yeah, okay.
Alright. Okay. So we'll be doing two responder CPR. Okay, that means one responder will be in charge of the airway, one responder will be in charge of the compression. Do you all know why we do CPR actually?
Yes.
Yes. Why do we do CPR?
To help
arrest.
when you
Okay.
do chest compression, you actually kind of like replace the heart to do the compression, and when you do ventilation, you supply oxygen to the casualty's blood.
Okay. How do you know that the patient is sustaining cardiac arrest? Come on, sit down now. You're very scary, like you're looking at me. Okay, come. Yeah, how do we know that the patient is sustaining cardiac arrest?
No breathing, no breathing, no pulse.
No signs of life, lah. Okay.
Yes.
That means patient is no longer breathing. Patient has got no pulse today. Alright. So how long is the duration that a patient that's having cardiac arrest? What is the duration before he is sustained brain injury?
4 minutes.
Yeah. So that means you got a 4-minute window to start your chest compression before you sustain brain injury, lah. Okay. So that's quite a short time period, lah, that you have. Okay. So I'll just give a quick scenario, lah. Okay. What's going to happen? Let's say you are. What's your name? Food. Where do you work? Where do you work? You working student or what? What do you? Student. College student. Okay. You are in college. Okay. So in your class, you have an elderly lecturer writing on the whiteboard. Suddenly he complains of chest pain and collapses on the floor. Okay. Since among your whole class, you are the only one that knows BLS, okay, what would you first look out for in this patient? Right? Let's say your lecturer's name is Mr. Mr. Abu. Okay, Mr. Abu. Alright? Your lecturer's name is Mr. Abu. Okay. How would you assess him first?
I will introduce myself for my class. Actually, I will assess you cardiac procedure.
Okay, nice. Alright, then?
Then I will check the danger, make sure the place is safe,
Okay.
the HSC and myself are also safe.
Okay.
Then check for response.
Okay, come, show me, come. We do together.
Miss Abu, Miss Abu.
You want to miss? You want to miss or you want to miss?
Miss Abu.
Okay, Mr. Abu.
Can you respond to me? No response.
No response. Okay, it's not responding. Okay.
Then shout for help and maybe assign one of the student or anyone to call for ambulance and request for AED.
Okay, come, we'll make it like a real scenario. Let's get one more person. Who wants to join? Miss Lim. Come, you want to join? Okay, maybe amongst your class, Miss Lim is the only one you ask. Everyone who else has got experience in BLS, Miss Lim puts up a hand. Okay? So you come, you ask Miss Lim to assist you. How would you ask her?
Basically, help me to call for ambulance and request for AED and recover to me.
Okay. Okay, let's say there is no AED lah. Yours is a very old cottage. There's no AED machine. Okay, so how would you ask her to help you then?
I will ask her to support the casualty.
Support in terms of the airway lah. Okay. Alright. So okay, you've already done your D, your danger. So okay, let's say patients are safe from danger. So you assess for patient's response. If patient is no longer responding. Alright, then what would you assess?
I have to shout for help and check for the airway.
Okay.
Limit is any obstruction inside, or and then check. The next is check for breathing. Breathing.
Okay, let's say patient you hear a gurgling sound. You hear like gurgling sound, breathing. So do you think the airway is better?
It's not very have some fluid.
Maybe with some fluid. Okay, what would you do to help to open up the airway?
Intuition it, and then
Okay.
do the evacuation. Have fluid inside.
Okay, so you do your head tilt lift. Maybe you want to show me how you do your head tilt. Okay, you open up your tilt lift. Okay, But in the scenario, let's say, that means in this scenario, patient is going to fall down, that means in the classroom, no evident trauma. Let's say in a trauma patient, where you suspect a cervical injury, would you also do head pinch and lift for that?
I will ask her to help me to do a job task.
Okay, alright, so you do a job task. Okay, everyone is clear on this, huh? Okay, so you do a head pinch and lift, okay? Okay, let's say you perform the head pinch and lift. Okay, now airway is patent, there's no more building sound. Alright, so airway you feel is quite clear now, and then what would you say?
And after that, I check on the is it have any breathing and pulse?
Okay, let's say, how do you assess for breathing? Look, listen and feel, right? Okay, so you look for any chest compressions, listen for any blood sounds, and feel the small air coming out. Okay, patient is not breathing. Okay, patient is not breathing, then what will you do?
After that, we'll start the compression.
Okay, so where do you place your hands for your chest compression?
And we just has to.
Okay, that's the reason, yeah? Okay, how would you do your chest compression? Okay, so he's doing it the right way, lah. Okay, come close. I'll just do it. Okay, so you have to make sure that your elbows are straight. Your power actually comes from your hips here. Okay, if you're going to do like this, okay, all your power is going to come from your arms. One thing is not effective CPR, and one thing you're going to get tired very fast. Okay, let's say you are the only one in your class who is actually only able to do CPR, then probably you have to conserve your energy, lah. Okay, let's say in a hospital setting where you can constantly rotate among your friends, then probably okay, you don't need to conserve so much, lah. But you have to think in this scenario, he's the only one except for Muslim, who is able to do CPR, so he has to conserve his energy and do it the right way. Okay, so come, continue. So you're doing CPR the right way. Okay, how would you do it? How deep would you go? How fast would you go? What speed would you go at?
5 to 6 centimeter. Minimal interruption. Minimal interruption.
You do. Okay, since he's focused there. Come, Chang. How would he do CPR?
5 to 6.
Okay, a depth of 5 centimeter. Alright, some more. You got all the criteria then for your chest compression. What is it?
That's fully required.
Okay, now full required. Come ask your friends to help. What else?
The rate must be 100 to 120 per minute.
Okay. Some more?
Minimal interruption.
How long? Minimum interruption.
How long? 10 seconds.
Okay, 10 seconds. Alright. So you want to push hard, push fast. Okay, first make sure that it's external region here. Push hard, push fast for a depth of at least 5 centimeters, which at a rate of 100 to 120 beats per minute. Allow complete chest recoil and minimize your interruptions of 10 seconds. Alright? Okay, so you will be doing the compressions. Let's say magically Lim has managed to find and be back. Okay? So she wants to be in charge of the airway. Okay, so how would you divide your chest compressions to your airway with Lim? Okay, you are the one doing the chest compressions. Okay, the Lim is a bit junior. Okay, so you tell her how should she assist you?
Ask him to control the trust and put the thing.
Put the airway back. Okay, alright. How maybe you instruct her how to check whether the airway bag is the right size, whether the airway bag is working. You want to help him out?
Is it the correct size?
The bigger one leaks air, right?
I think it's
The
The
smaller one is
yeah,
better.
better.
is it fully covered?
Okay. How do you check whether it's fully covered? Okay, you cover from the nose here, cover until the bottom of the mouth here lah. Okay, make sure that it covers fully. There's no leaking here when you talk. Alright. Before that, how do you make sure that your ambient bag is actually working? Okay, how to check your ambient bag is working? Whether there's any leak in the bag? Sure. Okay. So you want to when you cover the hole like this, okay, you should feel resistance here. Okay, if you don't feel resistance, that means there is a leak somewhere lah. Actually, you've got 3 valves here, one here, one is your valve here, and one is your lip valve down here. Okay, so easy way to check lah. Okay, just check here it is whether it's actually working. Okay, so ambient bag. Usually the ambient bag will have a reservoir bag here as well. Okay, the one that is connected to oxygen lah. Once you memang a full responder, maybe you have oxygen on the seat. Okay, so how do you check whether the reservoir bag is working? Pull out the reservoir bag. You have a reservoir bag here?
Yeah.
We have full set.
Okay. So this reservoir bag, okay. This reservoir bag should be around 2.5 to 2.6 liters lah, of oxygen you should be able to carry. So move back here. This one carries about 1.5 to 1.8 liters of oxygen lah. Okay. So when you attach your reservoir bag here, okay, you will connect the oxygen here. So what happens is this reservoir bag will actually inflate. Okay. So when this inflates, so where this will inflate and the reservoir bag here, and then pull in oxygen from the reservoir bag down here. Okay, to make sure that the reservoir bag is actually working. Sometimes you see old reservoir bags that have like leaks, that have cuts in here and there. And test first. Okay, reservoir bag is working fine. Okay, so the reason why we use the empty bag is you're giving positive pressure ventilation to the patient. Okay, pushing air at a very high speed to help to ventilate, inflate the lungs. Because patient now in cardiac arrest is not unable to ventilate itself. Okay, that's the reason why we give the empty bag to the patient. Okay, so this is a 2-person CPR, whereby you have one person who will take care of the chest compressions and one person who will take care of the airway. If let's say in that class the scenario was that he was in the classroom and then the teacher sustained a cardiac arrest. So let's say he was the only one who knows how to perform. He'll do a 1-person CPR. That one you know, right? You have 30 compressions, then you give 2 rescue breaths. Okay? So I'm just giving a scenario that let's say you have some equipment available, how you can do 2-person CPR in this case. Alright. So I'll demonstrate to us how you give the ventilation. Okay, so what clamp is she using here?
CE.
CE clamp lah. Okay, so you want to make sure it's betul-betul ada CE lah. Okay, and right, so you don't want doing it the right way. Alright, so make sure that when you are ventilating that there is no leak. Okay, good. She's putting the right position for the patient as well lah. Okay, and how will you ventilate? Okay, she's giving too much oxygen lah. Okay, so you don't want to give this much oxygen. The tidal volume that you want to give is only about 7 mils per kg per body weight. So actually you don't need to give so much tidal volume. So just this is enough. Okay, you don't need to squeeze the whole thing like that. A bit overkill lah for the patient. Okay, this is fine. This is fine. Alright. So how often will you ventilate the patient? Twice. So 30 compressions. 2 times lah. Okay, now you do the scenario. You do your chest compression, and then you start. You like that. You go. Okay, so you can see what he's doing. Any comments on how they are performing their CPR?
Doctor, when we do the ventilation, right, should we see the chest rise only, then it's counted as successful or not?
Well, usually the chest rise will actually occur because this is not a intubation. Intubation, then only you might accidentally go into the esophagus, not inside the trachea, and then you won't see chest inflation. But in this case, the air is confirmed going to go inside. So you observe from the chest rise, with the 2 ventilations, continue the CPR. The most important thing is actually going to be your CPR. Okay? So you see, certain guidelines for lay people, they actually don't recommend that you do the airway also. I think maybe you've heard about the compression only CPR, right? Okay? The main thing that is going to keep the patient alive is actually going to be chest compressions. But that being said, that doesn't mean that you have to neglect airway. Okay? You all are going to be professionals. Okay? You all going to be responders. So you actually train in such a way that you should be able to do it effectively. Okay? Okay, let's say in this scenario, she She's properly trained. She's got an empty bag and she's got a OPA as well. Oropharyngeal airway. You all are familiar with using OPA? Okay, we give someone else a chance. Who wants to try? Chang. That's okay, you can use this guy. You don't need to actually insert it. I just want to see that you all know how to use the OPA. Okay? Okay, first of all, this is your oropharyngeal airway. Okay, this is an airway adjunct. So this is going to help you to make sure that the oxygen is being delivered properly into your lungs. Okay, what other airway adjuncts do you have?
Laryngeal, LMA.
No, LMA is not an airway adjunct. Adjunct is something that helps. Yes, another one is your nasopharyngeal airway. Okay, so when do you use the oropharyngeal airway? When do you use the nasopharyngeal airway? Correct. So if a patient is fully not conscious, then you can use your oropharyngeal airway. Okay, if it's semi-conscious, don't use oropharyngeal airway, which can actually cause laryngospasm. Okay, so in your scenario, your Mr. Abu memang out lah. Okay, he's memang fully unconscious already. Now you already started CPR and you want to insert your airway adjunct for the patient. Okay, so in this patient, which would you recommend to use? Your nasopharyngeal or your oropharyngeal airway? Oropharyngeal airway, yeah. Okay, he's fully unconscious already, so he's probably got no gag reflex already. Okay, this is memang used if you've got no gag reflex. Okay, so the patient has got no gag reflex, so you put in your oropharyngeal airway. Okay, that being said also, there are certain scenarios where you don't use your nasopharyngeal airway. Yeah? Let's say you have a trauma patient and you can see visibly that there could be visible fractures here in the nose, maybe a fractured nose, or you can see there's some hematoma or something. Don't go and put in your nasopharyngeal airway and worsen it some more. Okay, so everything said, you still have to look at the patient and clinically decide what should or should not be done. Okay? Okay, so in this scenario, you are going to insert the nasopharyngeal airway for this patient. You don't need to properly do it, I think it's not like a team. Just show me how you assess what size to use and show me how you put it in.
So first I'll measure first.
Okay, very
From
good.
the angle of the mouth.
Okay.
To the earlobe.
Okay. This is the right size. It's a bit extra. Okay. It's not size, but it's okay. For the sake of illustration, just show. Okay, then how would you put it in?
So I follow the upper part of the mouth.
Okay.
And
We just pretend lah. It's not going to go inside the mouth. Okay.
until halfway, then turn.
Alright. Turn and put it in. Follow the force of the trachea. Alright. So once your oropharyngeal airway is in, I'll hold it for you lah. We just assume Okay then. It's an airway adjunct, right? So you still need your main method of airway, right? Okay. And then? Alright. Okay. Alright. Any questions you all have?
And just say the patient having C-spine injury,
Hmm.
you cannot tip the head, right?
No. Okay. Let's change the scenario. Okay, since you asked the question, you will be in charge. At least we get it a bit more interactive lah. You all at least get to try and use. I feel for me, I remember better lah when I see do it practically. Okay, we change the scenario. Where do you do?
You can call me Ian.
Ian. What do you do? Do you study or do you work?
Studying also.
Studying. Where are you studying? IMU. Okay, so you are on the way going to class. Alright. Then you notice that they are doing some scaffolding work. Okay, so doing some scaffolding work. They're carrying some billboard or something. Okay, as they're walking. Suddenly you notice you're shouting, screaming. The guy on the top falls down, lands in front of him. Okay, how will you assess the patient? You take some patient.
First, I will ensure that the environment is safe already.
Okay.
Okay, so after that, I will check for the response and things. So, sir, yes, sir, can you hear me, sir? So there's no response. Then after that, activate EMS, show for help.
Okay.
Okay.
Yeah. Okay, we actually make it a bit more fun session.
Okay, so Chuck, can you please help me call 999 for ambulance and go back to me and bring along an AED. Okay, thank you. Then after that, move on to airway. So since he fell from such a high press area, so basically I'll assume that there will be.
Okay, maybe you're not alone lah. You want to ask for help? Come, call for anyone for help.
Come ABC.
Your name is ABC, is it?
Everyone has trouble pronouncing it.
Oh, okay. So you call it ABC. Alright, fine. I'll call you full name, ABC. Okay. I don't know you well enough to call you ABC. Alright. Okay. Done.
So now I'll be asking her to do jaw thrust. Okay. So basically, I need you to place your thumb on the cheek. Okay, and then you just lift up, use your 2 fingers below, and then just lift up the jaw without extending the neck. Yeah, just lift up, push up, push up.
He's gonna move.
Okay. Alright, I'll give you the scenario as you do. Okay, so patient has already fallen down from a height of let's say 5 feet. Okay, when you assess the patient, okay, you have done your CPR, okay, patient is not responding. Alright, you try and listen for your airway, you notice that there is some gurgling sound from the patient. Okay, so you ask the video for help. Come we play down.
Okay, so after she done the jaw thrust, and then
Okay, let's say she's done jaw thrust, and let's say we all cannot intubate. Okay, fine. Okay, airway is now better. Okay, after doing your jaw thrust.
okay, then I'll be checking for breathing.
Anything else you want to assess for? What about cervical spine? Because you just studying your question was about cervical spine. Right?
Yeah. Okay. So I'll check. I'll be going down, see whether there's any bleeding or any swelling that you felt.
Okay. Anything else you will do? Let's say Abigail is a fully trained responder lah. She's got a whole bag full of tricks. Okay. Any equipment that you want, she's got. Right. What would you ask her to help you? Okay. See Abigail is on top. Alright. Okay. Now grab the cervical.
So basically, I'll ask Abigail to align it.
Okay. Show me how you do your cervical.
So you can please place your arm like this. Okay, hold tight. So basically, I'll measure first. So it's about 3 fingers. This is only 3 fingers, so fine. So first and foremost, I'll be sliding it in first. Like, so if you once you slide in, you remove your right arm. Okay, you place your hand here. You place your arm here.
Yes, I know.
Okay, and slide. Yeah, first. Okay, then your other arm can remove.
Okay, good job, Ian. Alright. So, if in a trauma patient, we always suspect cervical injury. Alright, because he's not responding to call already, so you're not sure whether he has a cervical injury or not. Okay, if in a normal trauma patient whose ECS is full, then probably you can assess lah. You can check what he did the side also lah. Check for any cervical tenderness. Patient is able to actively rotate the head 45 degrees now. Maybe that one you can assess. Okay, but in this kind of patient, ECS is not full. That means patient is already not responding. You always assume that there is a cervical injury. Okay, so make sure that you always make sure to suspect a cervical injury and do the necessary things lah. Okay. So what she did was right. She did a jaw thrust to ensure a patent airway. Okay, with your inline immobilization, put it as like a collar. Okay, good job, yeah. Alright. Okay, next.
So after this, since there's no breathing, we can straight away proceed to CPR.
Okay, come.
So why do you just do CPR after CPR is ready?
You should do everything. Yes, I agree with you. Among that is more. That's why you have actually 2 people lah. So he should actually immediately start CPR. He should be in charge of the airway. So cervical is actually part of the airway. So all this should actually be done by her lah. So if in the event that he is alone here, he should just do CPR. Okay, he doesn't. Probably maybe he doesn't have the equipment, or he doesn't have the time to do anything else. Focus on what he can do. Okay, you have to understand that we all have our limitations. Alright?
Just following the BRS.
Yes, you do have limitations. This scenario, I'm just getting you all to be familiar with the equipment. In the scenario that let's say you have a trained personnel here, then you can go this. Okay, but you have to understand that if let's say this scenario, you are alone, you got no equipment, you got no one to help you, you do what can save the patient to the best of your ability at the time. Understand? Okay, so maybe at the time he's alone, he doesn't have anything else, he does what he can do. He do his chest compressions, he gives his rescue breaths, 32 to 32. If he doesn't know how to do rescue breaths, compression only CPR. That's fine. Okay? We do what we have to the best of our ability lah. Okay? Alright, so come, continue your chest compression.
1, 2, 3, 4, 5, 6, 7, 8, 9, 2, 2, 3, 4, 5, 6, 7, 8, 9, 2, 2, 3, 4, 5, 6, 7, 8, 9.
You can't hold it.
Yeah? Alright. Okay. So you will be the one instructing her lah.
So you can give 2 breaths. Good.
Okay, let's say this scenario, you got OPA as well. Show me how you do the OPA.
But the person has a trauma away without the
Okay, you can give OPA unless memang you suspect a facial bone trauma, then you don't give this like the area lah, patient. Okay, but this one you can put in an OPA inside. Right, now show me how you want to put the OPA.
Yeah. So I go in.
Okay, first you have to measure. So you want first thing you need to know, okay, wherever a jump or whatever equipment you want to know, you have to know what is the indication for using it. You have to know how to use it, and you have to know what's the contraindication. That means what cannot use this airway jump. Okay, so that this is the thing that will help you to remember things. Alright. So what is the indication? Why would you use this airway jump?
Open the area.
Okay.
So, but this already helps us to open the airway. Why use it?
Okay, slicer collar is not meant to open the airway.
Like, got open the airway comes from.
No. This is not meant to open the airway. This is meant to stabilize the cervical spine. It is not a.
It don't help to open airway.
It does not. The function is not to open the airway. This is not the method. This is not the proper equipment to open an airway. It's now airway opening equipment lah. We have certain equipment that's used for airway. Alright. So this is meant for cervical spine immobilization. Alright. So that's something that you all have to remember. So your airway adjunct, that is an equipment that's used to help with the airway frequency. Okay. So alright. So your airway adjunct indication. What's the indication you're using?
I'm using it to open up the area of the patient.
Okay. How do you use it?
I have to bend lips from the lips, outer part of the lips to the earlobe of the ears.
Okay. Like this, huh? Okay. Alright. Then how do you use it?
Then
Before you use it, any contraindications or not? What scenarios you cannot use?
I cannot use it when there's any facial fractures that is visible to the eye.
Okay. No, use it in mouth. Okay
Or
lah.
if there's any obstruction inside the mouth,
Yes.
that is the eye.
Yes. Okay.
Some, if the tongue is also obstructed.
No. Okay. What contraindication? What kind of what situation you cannot use for
If there's oral injury, it is like
If let's say on the field you are not so sure whether I should use or not use, that is okay. Sometimes you're not so sure, you see that there's possible some fracture, something obstructing or what. Okay, you're not so sure, then it's alright. Don't use. Okay, you do what you can. No one is expecting you to be 100% on the field. Okay, everyone understands that there's limitations on the field, right? If let's say you can see an obstruction and you can remove it, then you can attempt, right? If not, it's okay. You just do what you can do. Okay, so let's say you put in the OPA already. You put in OPA. Okay, alright. Okay, anyone else wants to try? Come.
Just
Yeah,
one
yeah.
question. So let's say if one is perform CPR on the bed, let's say we have the ambulance, right?
Okay.
Because side view definitely have no space. So maybe like
Okay, that one a lot of cookies like.
Ah, yeah.
如果没有人可以帮忙
We have need to remove that need.
就是照做吧。
One thing is very
不用啊
difficult to do
因为
CPR
reading 比较重要
in ambulance. Okay, I've done it before. It is very difficult to do. No one expects you to be 100% accurate lah. Okay, that's why in the hospital setting, when we get a call telling us that there is a patient unconscious, probably they are already doing CPR, we will bring the machine. Okay, we will bring the of course machine. So it's much easier actually to do it in the moving van. Okay, rather than you doing CPR. But there are also scenarios where they tell us something different, but when we arrive, patient is unconscious, not responding, and we need to do CPR.
Okay.
So in a sense, we just do the best we can lah. Okay, so it just goes back to that. On the field, no one expects you to be 100%. Okay, you do what you can to keep the patient alive. Okay, so what CPR you can do, you do. Okay, if by the side, sometimes you'll be doing lah CPR, ambulance will be turning here, turning there, and then you'll be flying here, flying there. It's been done. Okay, it's memang very normal. Okay, but so you do what you can do.
In this situation, you should put this first
For your listening, is it?
for this situation. You should use this first or this second. But this one is because this one is for airway. It's like A, A, then B, C. Then we should use this one first or this one.
I'll do that.
So,
Okay, we take care of the airway first. At the same time, you have to make sure that it immobilizes fine. Okay, so that's why you have two people lah. We can help you to help put it inside for like this is a few seconds job. It won't take that long. Okay, so you make sure the airway is the airway is taken, put it inside for done. Okay, this part settled. At the same time, just doing this CPR. Okay, anyone else wants to write?
好
Then don't attach. You are on the field. Alright, if let's say you are in a hospital setting, maybe you are maybe you are then probably you can think of doing it. Okay, so again you have to understand things that you are on the field. Right? If you can see clearly and you can remove it, then you can do it. If not, okay. So your friend has got a very good question. Okay? Your friend has got a very good compression. Very good compression. Very good question. Okay? Let's say there is a foreign body obstruction. There's a foreign body obstruction. You cannot see the obstruction, right? And cannot ventilate the patient. So what would you do? So what would you do?
just do chest compression.
Okay, if you're on the field, then you just do your chest compression. Okay, if you are in hospital settings, then probably you need a definitive airway. Definitive airway, if on the field means, it's not really definitive airway, but the best you can try for is your legal mask airway. Right? If not, then we have to intubate the patient. If even in the hospital settings, you memang cannot ventilate the patient, cannot intubate the patient also, maybe there's an obstruction for me, cannot see, then what would you do? Yes, correct?
The emergency one.
So we have to do what we call a surgical psychothyroidotomy. Okay? Surgical psychothyroidotomy. Do they know about that? Okay. I'm just telling for your general knowledge lah. Okay. So in scenarios of CICO, that means CICO, cannot intubate, cannot ventilate. Okay? You cannot ventilate the patient. Okay? No matter what you're doing, you cannot ventilate the patient. This scenario, you want to intubate the patient. Try to intubate the patient, maybe it's very difficult intubation, maybe there's obstruction, something is happening, you cannot intubate the patient also. So what you do, go for your surgical psychothyroidotomy. Okay, I'm just telling as your basic general knowledge. Don't go and attempt this on the field. Okay? So how you do? First either you do what you can. You do your chest compression, you give your ventilation, the best availability. Okay, even though there's an obstruction, maybe a bit of oxygen might go in. Okay, so you do what you can to best ability. Don't try a big hero and you go and do a figure and you don't know how to do, it go and cause even more damage. Okay. I can teach them a bit about it. Yeah. Okay, so I just teach you a bit, but again, Disclaimer, don't try this, huh?
Okay.
Okay, so how you do your surgical cricothyroidotomy, right? So what you need to do is you need to pierce through the cricothyroid membrane. Okay, how you know which is the cricothyroid membrane? Okay, you all can feel yourself, right? Okay, so the first one that comes out is this. Your identity, you got very prominent one. Okay, apple. So this is your thyroid cartilage. Okay, go down some more. The second one that you feel is your cricoid cartilage. Okay, the space that you feel in between there, that is your cricothyroid membrane. You see sometimes in the movies all, they put the straw, breathe through the straw.
Drink through.
Breathe through the straw. So what they're doing is, they're doing a surgical cricothyroidotomy. So how you do it is, okay, so you palpate thyroid cartilage, cricoid cartilage, in between is your cricothyroid membrane. Alright, so you take a scalpel. Okay, usually we use two sizes, a size 10 and a size 11. Alright, first put the vertical incision coming down here. Okay, put the vertical incision showing the membrane at the bottom. That means you're just cutting the skin, cutting muscle, so you're exposing the cricothyroid membrane. Okay, and then you put in a horizontal incision. Okay, that means you already entered into the trachea already. Okay, and then you have a tracheostomy tube, or sometimes you can use a ETT tube also, depending what you have. Okay, put it in, then the same as normal intubation. Okay, test you back the patient. Okay, look for the chest rise. Alright, signs that memang is inside and then you suture it up. Okay, so this is a emergency situation where you do a surgical cricothyroidotomy. Okay? If in a PEDS patient, what would you do? PEDS, small kid. How would you do? Don't try surgical cricothyroidotomy. But you can do a needle You can put in a needle thyroidotomy Okay? But that's a bit more advanced Okay? Alright. Okay, come. Who else wants to try? Come, the one sitting right at the back. Okay. I'll give you another scenario. Okay, what do you do? You're studying, working? Where do you work? Office. Okay, you work in the office. Okay, let's say you're working in the office. You see, okay, there's some guy trying to prepare the aircon doing some wiring work. Okay, doing some wiring work. Suddenly you see him get electrocuted. Okay, electrocuted. Piece of electrical wire is dangling down there, just over his body. Alright. So everyone shouts, calling for help, and then you say, does anyone know CPR? This guy collapsed suddenly. You bravely go and raise up your hand. Okay? You can do it. Okay, what will you do?
Turn off the electric.
Okay. Yes. Yes, very good. Okay, so that's part of your danger. Okay, don't go when there's a piece of electrical wire hanging over the body. You like a hero, go and do CPR operation. You yourself get electrocuted, then now they have to do 2 CPR. Alright, so first thing first, danger. Okay, go back to danger. Make sure that the danger is settled. Okay, turn off the electric. Then, what do you do?
So the wire is away from the...
Oh, the wire is hanging here. Hanging here over the body.
Yeah, so just... there's no danger anymore, right?
Okay.
Not just remove him.
Yes, move the body to a safer location. Alright, move your patient to a safer location where you can safely do your CPR. Okay, so that's part of your danger. Okay, then?
And after that, he's not breathing, right?
You do it. You do it. Yeah.
So he's not responding.
Okay, he's not
Still
responding.
not responding. So we'll call for help.
Okay.
Sir,
Come, you can call anyone.
please call 999 for ambulance and get to me. Get me an AED.
No, we do 2% CPR. Say to the lady. Come, call anyone of your friends. Anyone. Kau nak baca dulu nak? Jadi dia orang main.
Sure. Hah? Wait.
she's fully trained. You got all the equipment, whatever equipment you want to buy. You don't know how to use AED, yeah? AED they already done. You want me to include AED as well? Okay. You want me to include AED as well in the scenario or? Yes. It's covered. I mean for the covered. Okay, our next scenario will do AED, yeah? Okay, shall we include AED in this scenario as well? Okay, you have AED machine.
There's a pad.
Okay, you pretend lah. So you pretend just as a bad. So we just with the back.
The AED has arrived.
Okay, AED has arrived. Okay, I'll give you all the space in it. Okay.
Make sure the chest is clean and dry, and then place the pads on the right upper chest and the other pad on the left lower chest, just below the collarbone. And then AED analyzing some CPR. And then take care. And then shall require whatever.
Okay, I give this scenario. Okay. So you already attach your AED monitor all already. Okay. Then they say shock advice. Alright, how would you do?
Take care. Then shock. Analyze. Then shockable.
Okay. Shock advice means remain shockable already. Okay, then when you attach the AED, they already tell you shock advice. Okay. So,
Clear. Everybody clear. Shock. And then continue CPR.
Okay, do lah. Okay, shock. Okay, continue CPR.
Another AED has arrived.
Okay, so one person will be doing your chest compression, one person will be start the airway. So you talk it out lah. In your exam, sure they will ask you how will you do your CPR, how will you manage doing the chest compressions in your airway. So these things all they will ask you. So why not you talk us through it lah as you do your chest compression.
Okay.
So how will you do your chest compression if you are the one doing that? I'm giving you an exam setting. Usually when we sit for ALS exam, we usually, as we do, we talk it out. Okay? First during, okay. So I just show you an example. Okay? In an exam setting, this is not in real life. Okay? Exam setting, so you remember approach patient, you already done your E, your R, okay, check for danger, check for response. So any response, the examiner will tell you no response, patient not responding. Okay, so then you check the signs of life. You look, listen, feel. Alright? See whether he's breathing or not. Listen to any breath sound, can feel his breath or not. Okay, patient is not breathing. Okay, the examiner will tell you, no, patient is not breathing, she's got no pulse. So you immediately start your CPR. So you do the CPR, and after that you tell out now. Okay, doing my CPR, the location is at the sternal region here. Okay, I'm going to push hard, push fast. I'm going to push to a depth of 5 cm. I'm going to allow complete chest recoil. I'm going to push to a rate of 100 to 120 beats per minute. Allow minimal interruptions of 10 seconds. This is just how I'm teaching you how to get your good points in your exam result. Okay, so as you do this. So then another friend of mine will be in charge of the airway. Okay, one will be in charge of the airway. So I will be giving my chest compressions 30 is to 2 breaths. Okay, let's say you got AED in your exam. I'm not sure how your exam is going. Say you got AED in your exam, you already asked for AED already. You come and put the AED, analyze for rhythm. Say the examiner class is comfortable rhythm, administer the shock. Shock administered, continue CPR. You yourself do this CPR. Okay, just giving you how in the exam you see how you do that. Okay.
how to move, right? Do you have time to talk like press hard and fast all of that?
Usually in exam lah, the exam usually CLS exam one, you don't actually do CPR lah. But I don't know your exam how if we go for exam, CLS exam, that means we are the head of the station. So that means I got two helpers. One helper do CPR, one helper will do airway. I shock the patient ni. So I tukang bagi advice ni lah. I'll tell him, okay, you do this much, this much. You take care airway. You give 30 to 2. Okay, then once you intubate, in 1 to 6 seconds. Usually our setting, that's how we do our exam lah. Okay, if you all memang have to do the CPR itself, and you got the breath, then you tell lah. Or if they ask you, then tell lah. Okay, that's just something to keep in mind lah. Okay, so we continue our scenario. So already shocked one time already. Continue chest compression. Continue. Okay, then tell her how to do the thing. Okay, so for how long will you do your chest compression? Okay, you already put in your AED, right? Okay, so when next time you want to check your pulse, check your rhythm, check your cardiac rhythm. Okay,
So 1 set.
so you already completed 1 cycle, you come and it out. Okay, so you already done your chest compression. I tell you 2 minutes is up. Okay, then what do you know? 2 minutes is up.
So check some of that.
You check lah, don't pass. Okay, check don't pass, check the rhythm. Once you finish your 2 minutes, okay, check the rhythm. Whether it's a shockable or non-shockable rhythm. Okay, if it is not shockable rhythm, you have or what? Shock the patient. Okay, sometimes maybe you already shock the patient now, then now it's a non-shockable rhythm plus maybe the PA system. So you also check the patient's pulse as well. Okay, so you check the patient's pulse or no pulse, and I tell you it is shockable. So then what is? Same thing, so you shock again also. Okay, shock again. Then immediately continue CPR. Continue.
Just follow the AED, right?
You just follow the AED. But you still need to know that in theory, every 2 minutes, you shock, check pulse, and check the rhythm as well. Okay, so you just do this every cycle 2 minutes until when do you stop CPR? So you stop CPR after 3 scenarios. Okay, one thing is until your help arrives. And another thing, if you already got sign of life, or another thing, yes, alright, you have to try to continue lah. Maybe after more than 1 hour, or if you try to continue, then you can stop CPR. Okay, well done. Anyone else wants to try? Come, we do one last one.
One last scenario.
One last scenario. Come, anyone wants to try?
Those who haven't done the please volume. There the two of you. The two of you.
Hypothetically.
Patrick.
See, my voice said very
Yeah.
So what if the person is,
Right,
good
anyway.
at I can't perform, not say can't perform.
Go.
Yeah, like, should I not do CPR?
No.
At least do
At least do
something.
something. Okay, if you feel that you are unable to give proper
Like
CPR,
5 cm.
you try the best you can. Again, like I said, you on the field. You do based on whatever limitations that you have. Okay? Whatever that you have, you try and do. Okay? You are already a trained BLS provider. You can't when they come and ask why no CPR was given. So no, at small side I felt like I couldn't do so I didn't do a CPR. So you try the best that you can. Okay. Okay, so you all got everything here already. You got your ED, you got your select collar, you got your medical mask, you got your pump.
Doctor, the pet.
Okay, you got that.
他什么才不是？
You all got trauma. Why you all want to see? You want to see trauma case? Trauma case. Okay. Okay, you all are memang now you pass your exam already. Okay, you are now trained providers lah, your first responders already. Okay, so you receive a call, there is a motor vehicle accident. Okay, patient is a motorbike rider. I unsure that
Your AD juga AD.
was found by passerby, claim patient not responding on scene. Okay, so both of you are the first on scene. Right, how will you manage the patient? Can talk it off. Clear the danger, lah. Again, let's say patient is lying in the middle of the highway. So, how will you clear the danger? Okay, so danger is not just to you, danger to patient as well. You can be doing CPR in the middle of the highway, kan? So you move the patient to a safe and secure location, maybe by the side there, someone that is safe. Okay, so you're part of danger. Okay, let's say danger now. You already move the patient in the middle of the highway, you move into a safe and secure location already. Right, then next. Response. Okay, how will you assess the response? No response. Okay, now for help. Okay, but you are the help, lah. Okay, in this scenario, you are the help. Okay, then. Okay, in this scenario, you are the ambulance, You are the ambulance, you brought on your AED already. Okay, that means you are the first responder. But I understand, if let's say you are on the field, you will do that,
on the side, so doing shop for help.
But in this scenario, you are the help. Okay, alright, next.
Cho tụi lại lại.
We have more than one patient.
Okay, so you check the area is written or not. Okay, let's say from the room sound or what, you check outside.
那个 spine 有没有嘛？对不对？他们是 spine 有没有嘛？
Then you see, okay, maybe there's no circulation, there's no foreign body visible. Okay, then.
那就是直接中穿的嘛，那中穿手术，那口都不用看了的嘛。
他吸口的是直接塞下面这样过去。
不是，那应该就是这样，直接进来就我讲，他不可以这样的话，就是看着放上去接刀嘛。
所以这里有 inline mobilization。
还有口外就是，还是你普通哦，他那个跟他讲就是
行嘅，可以，没。
都没学的没？
不知道。没学。
没有想过让我讲一下，就是他是那个杀人的这样的，就是这样可能他不是他妈就是这样，你就不用你就不用 suspect 他是有少一个spine 的嘛，对不对？所以就不用
他刚才讲是trauma。
他讲
Look recently,
suspect.
You look for any right?
I think suspect.
You should not read it.
但他就一定
check on the box.
就不是
spine， 不是 spine 的原因，明白吗？因为他讲是 trauma，一定要说出来的。
You got to be clear, so you can tell her what
一定要来的。
对。他在做么？KD 噻。
Okay, she touched the area.
不是投入很急，不可以上个这有什么东西？因为我记得他讲会 crack， 他会 fracture 跟勾力。不要。
Okay, let's say the AD is ready to analyze rhythm. The AD is telling they want to analyze rhythm. Okay, stop your chest compression. Okay, analyze rhythm, then sharp advice. Okay, sharp administered. Okay, continue. So how will you do your CPR? Where is the location? You can put your hands. Okay. How deep will you go? And how fast will you go? And then the record. The interruption. How long?
假如是这个角度给我看的话，
Maybe you put in your is it indicated in the special? Put in your severe limit.
必须求神拜佛，不然
是他外在这只东西跟他有
You can put in your part of the head. Okay, so you put in your leg, then you do your ventilation. Okay, so to take compression.
那个我可以放上去，很会漏气。
Understand? Okay, so when you stop the CPR, okay, or you have or
你先确定才按，确定才按对。
right?
都可以，
Anything else? Any question, Jordan?
这样你就够力啊，有那个。
再按紧点，拿上去啊，再按。
Put the belt first. Put the belt first. Okay? That is important. Okay? If let's say patient in ventilation, that means the short rhythm, the only thing that's going to bring the patient back is going to be a shock. You CPR until 2 days or so, it's not going to come back. Okay? So, really very important. Alright? Anything else? Any other questions, John?
During compression, right? The back must we can't put it on the face first, or when, or you can put it during compression.
Any other question? Okay, you all feel enough practice? Do you all want to practice one more round or what?